Joining us in studio from Beautologie is Dr. Darshan Shah. We are so glad to have you joining us today. We have a lot of really fascinating things to talk about, and we really appreciate your time. So welcome to Live Well.
Thank you. I'm glad to be here. This is great.
First thing I wanted to talk about with you today is the article that I read that was in the latest edition of Bakersfield Life, and it was about breast augmentation and the difference in, I had some friends 15, 20 years ago who had them compared to what we're seeing now, the downtime, the scarring, who's getting them.
Right.
So let's just start with maybe the difference in technology and the difference in operation or
Sure. Yeah, I mean, things have completely changed over the last 30 years, right? And the reason is the whole society, I think our whole society is getting more acceptance of this, and so more people are doing it. And I think people's lives are busy, so we're trying to make the procedure less invasive, safer, more predictable outcomes with smaller incisions so people can get on with their lives a lot faster, right?
You're thinking 2 to 3 days to a desk job.
Yep,
for
exactly.
a full breast augmentation.
Right. So here's what we've been seeing lately, actually, is even less recovery time. We've really honed our techniques in surgery. Basically, the surgery is done in less than an hour. You're home within a couple of hours after the procedure. And a lot of people are now telling me the day after, they basically feel almost no pain at all. And they're back to work by Monday. Surgery Friday, work Monday.
How is that possible? Is it just the new procedures, the new technology, the difference in the implants now? Because I was reading that they're also not just the saline, but there's still the silicone.
Silicone, right, exactly. So the implants have been completely redesigned in the last few years. The FDA had problems with the old implants, if you remember.
Safety concerns, I do.
Yeah. And so they used to be filled with liquid silicone, and now what they're doing is filling it with more of a solid silicone. So you can actually cut the implant in half, and you don't have liquid leaking out of it. It sticks together.
So that way it doesn't leach into the body and cause the problems that happened 10, 15 years ago.
Exactly. So with that change, though, there's also been changes in the shell of the implant that are much thicker shells, but they still feel softer. So what you have now is an implant that's much safer. Basically, it has a lifetime warranty on it, believe it or not.
Really?
So they kind of make it to last a very, very long time. And our techniques in surgery are also getting a lot better too. We know now how to numb the breast, how to place an implant with causing the most minimal amount of damage to the surrounding tissue. So when the implant's placed, the recovery's a lot faster. I mean, if you saw the surgery, you'd be so surprised because the incision is tiny. It's just like an inch or a little bit longer. And we basically lose like no blood, maybe a drop of blood during the entire case.
What's the bruising like after that?
Most of my patients have no bruising, zero.
And do they have to wear those garments and things? It seems like sometimes when you have a type of a plastic surgery, there's what's called compression
garments. You don't need any of that anymore. Now we just use just a straightforward sports bra. Yeah, just a regular sports bra. We actually give it to you right after surgery. And we don't like people wearing underwires for about a month afterwards, but then in a month you can go back to wearing underwires just after everything's all healed up.
What kind of medication would you go home with? Say someone, what kind of, if they're concerned about maybe the kind of medications they would be taking afterwards?
Yeah, absolutely. I mean, we give everyone a good amount of things for just in case. Most of it you never end up using.
I think people are concerned maybe about infection. Could be a big concern.
Everyone gets antibiotics before, during, and after the procedure. After the surgery, we also give you pain medication and muscle relaxant in case you need it. We give you some Arnica Montana. It's a bruising medication, so prevent bruising, and some nausea medication just in case. But most of my patients just end up taking the antibiotics and some Tylenol, and they're good in a few days.
How popular is this procedure?
So that's something that surprisingly is getting more and more popular every single year.
Why do you think that is?
So the Americans...
Just because it's getting simpler. Not so invasive.
That, and also I feel like there's a lot more acceptance. And so what's happening is, people used to think of breast augmentation as like Dolly Parton. That's the first thing they thought of, right? And now everyone has a friend or two or three that have done it, and you wouldn't even know that they did it unless they told you, you know? And I think people accept it more, and people know that you don't have to have kind of the overdone, ridiculous results as some that you see on TV that everyone talks about. So I think acceptance is better, recovery time is better. We also, the pricing is more reasonable. So all that combined makes it more accessible to more people.
I wanted to ask you about the age ranges because this isn't a surgery for, young women. Because, at what point do you say you're not done developing yet?
Right.
What would you recommend?
So our minimum age is definitely 18 years old. And that's, we don't do any surgery on anyone less than 18 because you're not done developing. Now, even from 18 on, we try to tell the woman, you really want to maybe have your kids first and then think about doing this.
It changes everything.
Exactly.
Yes.
It changes everything. And, there's some 18-year-old or 20, 21-year-old women that really are self-conscious because they don't have much to start off with, or maybe they have a condition like asymmetry or tubular breasts, which is a kind of a different shape of the breast. And so those people are actually good candidate for breast augmentation. But I'll tell you, 90% or more of my patients are all moms that are done having children.
Really?
Yeah.
What's the oldest patient maybe you've had, if you could share that with us? This fascinates me.
Yeah. I mean, you know what? 65. Yeah, 65 years old, or maybe even 68. I don't remember exactly, but you'll be surprised. I mean, people in their 60s now, they feel like they're in their 40s.
Right.
They don't feel like they feel a lot younger than what they see in the mirror, and so they come to us to kind of turn back the clock so the mirror matches how they feel inside.
Right.
Yeah,
And
it's
that's
really great.
all about what you do.
Right,
You give the
right.
people that confidence.
Exactly.
A lot of my friends, and I'm not going to name names, but I have a lot of my mommy friends who are saying, well, what if I don't do the full augmentation? But
Yeah.
what's the difference between an augmentation and a lift?
That's a great question. So an augmentation fills in loose skin. If you were to do a lift, what you're doing is removing loose skin, and it won't give you that full look, okay? So some women that already have fullness, like maybe they're in a D cup bra already, but they're just having some sagging, a lift is more appropriate. If you don't have a lot of volume, we need to put some volume back in, and that's when you need an augmentation. Now, some women get both because they have a lot of loose skin and they need more volume. So the best thing to do is really see us. We'll make measurements on your chest. We'll listen to you. What I always do with every patient is listen to what they want and then give them a solution that matches what they're telling me.
There's
You
probably
see?
a lot of different reasons. I had a friend that had one because she just felt that her backside didn't match her front side, and she wanted to
Exactly.
kind of even herself out.
Right, yeah, just make something that matches your body frame is really important. And so we have it down to a science where we measure the width of your breast. Based on the width of your breast, your body frame, we can recommend sizes that get you to where you want to be.
And here's the next question. What if you're thinking, I don't want to commit to this surgery and not know what it's going to look like on my body? There's something you can do to prevent those questions or to
Yeah.
answer those questions for folks.
That's the biggest concern that most people have.
Yeah,
It's like,
'cause you really can't go back. I mean,
Yeah.
you can, but you really don't want to.
you don't want to, right?
Sure,
Exactly. You want to get it right the first time.
Right.
So we do a lot of things before to make sure the woman has a really good idea of what it's going to look like afterwards. Now, we used to use computer morphing.
I've seen that done.
Yes, yeah. But what we found is really that gives you sometimes an unrealistic view of what it's going to look like.
We know how it feels, and it's going
Right.
to change your whole center of balance.
Right.
I'm equating that to being pregnant, and just that
Yes.
you'll have all that weight out front that you're not used to dealing
Right,
with.
so you said it like you don't know how it feels when you look at it in a computer, how it's going to feel on you. So what we found works the absolute best is we actually have you try on the implants in our office. So we have a special bra that holds the implants, and we put the implants in this bra, and you try them on. You try on different sizes. You put a shirt on top. We take pictures and different poses of you, so you could see what it looks like on you, and you could feel what it looks like on you.
Wow.
Yeah.
We only have about 2.5 minutes,
Oh, okay.
but walk us through. I could talk to you all day. Again, we really appreciate you coming in.
Yeah.
But walk us through the typical surgery day then. If someone's thinking about it and they just kind of wonder what's going to happen, not
Right.
even surgery day, but when you make that first phone call to
Yep.
Beautologie,
Yep,
what happens
absolutely.
at that point?
That's a great question. I think a lot of people have a fear of what's going to happen. Some people come at their first consultation, they're so fearful, like we're going to do the surgery right then and there, and we're not. I always reassure them that we're just here to talk about it. So basically what happens, you call us, you come in for a consultation. It's about an hour-long consult with me or one of the other doctors. We talk to you about your desires like we talked about. We make measurements. We have you try on the implants, and then you choose a size and the procedure is going to work for you. 2 weeks before your surgery, once you decide to have it done, we have you come in for an in-depth session that we call the pre-op, where we go over everything in detail, how to prepare, how to take care of yourself afterwards. And then on the day of surgery, really for breast surgery, you're only there for about 3 or 4 hours. We have you come in. We have a really relaxing room that we put you in. We give you medication to make sure you're super relaxed, and then we take you back into our procedure room where you're completely asleep. We make sure that you can't hear, feel, or see anything, and so you're very, very comfortable.
Right.
It's the safest way to do it. You definitely want to be taking a little nap while you're doing this.
Yes.
And then an hour later, the surgery's done, and you're in our recovery room. Our nurses make sure you're comfortable, and they let you go home with your family member.
And there's a
No.
follow-up after that?
Absolutely, yeah.
And they
So,
come in?
yeah, so you come in a few days afterwards to make sure everything is healing good, and then we keep seeing you until you're satisfied and we're satisfied with how everything looks. And usually that takes about a month or two.
Because there's a little swelling and your
Right.
body's just kind of, and you're getting used to all the new stuff.
Right,
Interesting.
exactly, yeah.
Well, if people would like more information, where can they find that about Beautologie?
Oh, they can call our office and come in, or they can go to our website, Beautologie.com. There's a ton of information on there. Call our office, and we can even mail you information.
And what else? What other types of procedures do you offer at Beautologie?
Oh gosh, it's a huge
Everything.
list.
I know.
We
I
do
can't
it
believe I just
all.
asked you that.
We do it all. Everything from the mommy makeover, tummy tucks, breast reductions. We also have a full medical spa with all the non-invasive things that my brother, Dr. Shaw, does. Botox and fillers and lasers. So pretty much everything you could think of, you read about, we offer it. And if we don't offer it, there's a reason we don't offer it. So
Well, can't thank you enough for your time. Have a wonderful
Yeah,
day.
thank
Thanks
you.
again. And remember to live well.